Welcome to the deep dive. Today, we're really getting into something important. How liver infections and inflammation can ultimately lead to cirrhosis. We got some great material to guide us.
Absolutely. It's all about connecting the dots, seeing how these things link up to affect such a critical organ.
Right. And maybe we should start with just a quick reminder of what the liver actually does. It's a powerhouse.
Definitely. It sits up there at the top right of your abdomen, packed with these cells, hepatocytes, doing all the work. And it's got this unique blood supply, the hepatic artery shore, but also the portal vein.
That's the one bringing blood straight from your digestive tract, right? Full of nutrients.
Exactly. Full of everything you've just absorbed. And we'll be looking at, two main kinds of trouble. Direct damage to those liver cells and problems with bile flow.
Okay, so let's tick off some key functions. Digestion comes to mind first. Bile salts.
Crucial. The liver makes them to break down fats in your intestine. Then they're stored, conveniently, in the gallbladder.
And they get recycled. I remember reading about that. Enterohepatic circulation.
That's the one. They get reabsorbed further down in the small intestine, then wham, back to the liver via the portal vein. Ready to go again. Super efficient.
Yeah, it really is. What about bilirubin? That's tied to red blood cells, isn't it?
It is, yeah. When old red blood cells break down, hemoglobin splits, and part of it eventually becomes bilirubin. This stuff travels to the liver.
And the liver does what with it? Makes it safe to get rid of?
Pretty much. It conjugates it, makes it water-soluble so it can go out in the bile. Then gut bacteria convert some of it to urobilinogen.
Ah, and that's what makes urine yellow.
You got it. So changes in urine color can actually be a clue about liver function.
Wow. Okay. Beyond that. Metabolism. It handles fats, right? Yeah. Making cholesterol, too.
Yep. Bile helps emulsify fats for digestion, and the liver synthesizes and packages cholesterol. It's central for proteins, too, making albumin, which is vital for blood fluid balance, and dealing with amino acid breakdown, which produces ammonia.
Ammonia. That needs detoxifying, doesn't it?
It does, and the liver handles that. It's also key for carbs storing glucose as glycogen, releasing it, even making new glucose if needed. Oh, and blood clotting factors, like fibrinogen. Huge role there.
And detoxification generally, like medications and stuff.
Absolutely critical. Everything absorbed from your gut hits the liver first via that portal vein, the famous first pass effect. It processes drugs, toxins, you name it.
It also stores things, right? Vitamins, minerals.
It stores vitamins A, D, B12, iron, copper. And it produces other important things like IGF-1 and thrombopoietin.
Thrombopoietin, that's for platelets, blood clotting again?
Yep, helps regulate platelet production. See, it does so much.
Okay, so it's clear if the liver isn't working properly, things go wrong. Our source mentions a few key downstream effects.
Right, you start seeing problems like fewer clotting factors, so more bleeding risk, lower albumin levels, detox gets sluggish, nutrient storage suffers.
Problems processing bilirubin, too, which we'll get back to, and that ammonia buildup from protein breakdown. It's a cascade.
Exactly. And one of the most visible signs that something's up is often jaundice.
That yellowing of the skin and eyes.
The sclera, the whites of the eyes especially. It comes from hyperbilirubinemia.
Yeah.
Basically, just too much bilirubin floating around in the blood. They sometimes call it icterus.
So jaundice means high bilirubin. Why does bilirubin build up? Our notes mention three main ways.
Yeah, think of it like this. Either you're breaking down too many red blood cells before the liver gets involved, it's prehepatic.
Oh.
Or the liver cells themselves are damaged and can't process it properly, that's intrahepatic.
Makes sense.
Or there's a blockage after the liver in the bile ducts, stopping the bile from flowing out, that's posthepatic.
And posthepatic is often caused by gallstones.
That's the most common culprit, yeah. The tumors can do it too. It's like a blocked drain, essentially.
And with a blockage, you'd expect, well, the jaundice, obviously, but also dark urine.
Exactly. The bilirubin that can't get out through bile finds another route, the kidneys. So dark urine is a classic sign alongside the yellow skin.
Okay, let's pivot to specific infections. Hepatitis A, HAV, generally mild.
Generally, yes. And thankfully, we have a vaccine, so it's much less common in places like the U.S. compared to, say, parts of Asia or Africa.
But still a risk for some groups here.
Definitely. The source points out men who have sex with men, illicit drug users, people experiencing homelessness, they're at higher risk.
And crucially, when is someone most contagious?
Usually about 2 to 3 weeks after they're exposed. And here's the thing that can be before they even show signs like jaundice.
Oh, wow. So they could be spreading it without knowing. What are the typical symptoms?
Fever, some abdominal pain, often general flu-like stuff, nausea, vomiting, feeling tired, achy muscles and joints, headache. Sometimes people lose their appetite or taste for food.
I read smokers might even lose their taste for tobacco.
Yeah, it's a weird one, but reported. Might be the only upside, temporary as it is.
Okay, let's move to hepatitis B, HBV. This one sounds tougher.
It is. The virus itself is quite resilient. And the risk factors, well, there are quite a few. Things like ethnicity, non-Hispanic African Americans have higher rates. Cocaine use, multiple sexual partners, unprotected sex, having other STIs, being HIV positive, also handling blood products, IV drug use with shared needles.
Seems like transmission through bodily fluids is key.
Absolutely. Also, being a man who has sex with men, living with someone who has HPV, being on hemodialysis, or even traveling to areas where it's very common, Africa, Asia, Eastern Europe.
And the infection itself, it progresses in stages.
Typically, yes. There are about 4 phases described. First, incubation. 2 to 4 weeks, usually no symptoms, but the virus is multiplying like crazy and you can spread it. Liver enzymes are still normal at this point.
Okay, then what?
Stage 2 is the inflammatory reaction. 3-4 weeks maybe, now you might get those flu-like symptoms, maybe jaundice starts. And crucially, doctors can detect HPV markers in the blood, HBsAg, HBmAg, HPV DNA, and your liver enzymes shoot up. That signals liver damage.
So the body's fighting back.
Exactly. Which leads to stage 3, immune clearance. The immune system actively attacks infected liver cells and the virus itself. Viral replication slows down, HBV DNA levels drop, maybe become undetectable, and liver enzymes hopefully start to normalize.
And the final stage, resolution.
Ideally, yes. Virus gone, antibodies developed, but, and this is a big but HPV often becomes chronic, especially if you're infected as an infant or if you have certain conditions like Down syndrome or are on dialysis or immunosuppressed or HIV positive.
So chronic HBV, that means the virus sticks around.
For many,
Yeah.
yes. They don't fully clear it.
Right.
And having chronic HBV, especially if you're older or have other health issues, significantly raises your risk of severe liver disease down the line, including liver cancer, hepatocellular carcinoma. That chronic inflammation just wears the liver down.
What does HBV look like clinically? Is it always obvious?
Not always, especially early on. The incubation period can be long, like 2 to 6 months, often with no symptoms. Then you might get that flu-like illness, poor appetite, pain in the upper right abdomen, jaundice, itching, dark urine, and large liver, maybe pale stools.
How's it managed?
A lot of it is supportive care. Small, high-calorie, high-protein meals can help. Antivirals exist, but they rarely clear the virus completely. Prevention is key, the vaccine is very effective, and giving immunoglobulins to contacts helps.
But once you have chronic HBV, it's basically for life, with that cancer risk always there.
That's the tough reality, yes. Ongoing monitoring is crucial because of that chronic inflammation link to cancer.
Okay, let's talk hepatitis C HCV. This one also targets liver cells.
It does, hepatocytes and also some immune cells, B lymphocytes. The big difference with HCV compared to, say, HAV is this tendency to become chronic. It sets up this long-term smoldering inflammation.
And that inflammation causes damage over time.
Exactly. It triggers the liver to lay down collagen, forming fibrous scar tissue. We call that fibrosis. This scarring messes with the liver's structure, interferes with how hepatocytes work, and, importantly, contributes to portal hypertension.
Portal hypertension, you mentioned that earlier, increased pressure in the portal vein.
Precisely. Remember, that vein brings blood from the gut to the liver. If the liver is scarred and stiff from cirrhosis, blood flow is obstructed, pressure backs up in the portal vein. It's like a traffic jam.
And the body tries to find detours.
It does. It forms these collateral vessels, alternative routes for the blood. But as cirrhosis worsens, the pressure just keeps rising.
What does that look like? What are the signs?
You can get things like caput medusae, those visible swollen veins around the belly button. The spleen can enlarge, that's splenomegaly. You get fragile, swollen veins in the esophageal varices.
Those sound dangerous.
They are very prone to rupture and bleeding. You can also get varices in the rectum. And eventually, the high pressure forces fluid out into the abdominal cavity. That's ascites.
Wow. So cirrhosis itself, whether from hepatitis B, alcohol, or other causes, leads to a whole host of complications because the liver just can't do its job.
That's right. The list is long, unfortunately. When detoxification fails, ammonia builds up.
And that affects the brain, encephalopathy.
Correct. Leading to confusion, drowsiness, even coma. Protein synthesis suffers too.
Meaning fewer clotting factors.
Yes, so easy bleeding and bruising.
Yeah.
And low albumin. Albumin helps keep fluid in your blood vessels, so when it's low, you get edema swelling, and it contributes to ascites as well.
What else? Problems with the bile.
Yep. Decreased bile synthesis, or flow, means poor fat digestion, leading to fatty stools, steatorrhea. Bilirubin processing fails, causing that jaundice we talked about.
And all those waste products building up in the blood.
They contribute to the encephalopathy and can also damage red blood cells, causing anemia, and lower platelet counts, thrombocytopenia, making bleeding risk even worse.
You also see that flapping tremor, asterixis.
Yes, that's another sign of encephalopathy. And in very severe cases, the liver failure can actually cause the kidneys to fail. That's hepatorenal syndrome. Really serious.
So the overall picture of someone with cirrhosis can be quite complex, with symptoms touching almost every system. How is it diagnosed definitively?
Well, blood tests often give the first clues. You look for low albumin, low platelets, high liver enzymes, high bilirubin, maybe a prolonged clotting time, the PT test. Anemia might be present.
But the gold standard is...
Still a liver biopsy. Looking at a tissue sample under the microscope shows the scarring and damage directly.
Are there ways to stage it, to know how severe it is?
Yes, doctors use scoring systems. The Child-Turcotte-Pugh score helps stage it and predict mortality. And maybe even more important now is the MELODY score model for end-stage liver disease.
What's the MELODY score used for?
It's critical for prioritizing patients for liver transplants. It gives an objective measure of how sick the liver is and estimates short-term, like 3-month, survival chances.
Okay, so if someone has cirrhosis, what's the treatment strategy?
The main goals are really to stop it getting worse, manage the complications, and prevent death. That means regular monitoring blood tests, calculating those scores, usually every 6 months or so.
And transplant evaluation.
Definitely.
Yeah.
If the MELODY score hits 15 or more, or if major complications like batocytes, encephalopathy, or variceal bleeding occur, transplant needs to be seriously considered.
What about managing things day to day besides transplant?
Lifestyle is huge. Number one, absolutely no alcohol. And be very careful with medications like acetaminophen Tylenol. Limit the dose. Vaccinations are important too, against things like Hep A, Hep B, pneumococcus, flu.
And specific medications for the complications?
Right. Diuretics for ascites. Non-selective beta blockers can lower portal pressure, reducing the risk of varices bleeding. Special sugars, not absorbable disaccharides like lactulose, help manage encephalopathy by reducing ammonia. There are drugs for itching and supplements for vitamin deficiencies. It's about managing the fallout.
Got it. One last thing mentioned in our source was biliary cholangitis. How does that fit in?
Yes. That can happen from long-term blockage of the bile ducts, either inside or outside the liver. Seems to be more common in women, often in their 50s or 60s.
And the symptoms, are they similar?
Sometimes the presentation can look a bit like fatty liver disease initially, but you can see jaundice, ascites, those prominent abdominal veins, spider nevi on the skin, red palms, sometimes even neurological issues like difficulty speaking, tremor, personality changes. Diagnosis often involves checking copper levels in urine.
Why copper?
Because bile is the main way the body gets rid of excess copper. If bile flow is blocked long-term, copper can build up. Treatment often involves chelation therapy to remove that excess copper.
Okay, so pulling this all together, it's really striking how infection and inflammation can start this whole process, ultimately leading to cirrhosis and its widespread effects.
It really is. It underlines just how central the liver is. Digestion, metabolism, detoxification, clotting. When it struggles, the ripple effects are massive.
It definitely makes you appreciate how crucial it is to understand the risks, whether it's viral hepatitis, alcohol, or other factors, and to get things checked out if you have concerns.
Absolutely. Early detection and management are key. Which leads to maybe a final thought for you, our listeners, to chew on. Considering everything the liver does, this incredible range of functions, what lifestyle choices do you think really make the biggest difference for keeping it healthy long term? Something to think about.